Hello there, welcome in. My name is Dr. Basil. It was a pleasure to meet you. From my understanding, you're here for an allergy test, is that correct? Absolutely. Okay, I have all your information here. What I would like for you to do is to just describe to me your symptoms, some of the things that you might be experiencing. Okay. Okay. Okay, so some sort of skin irritation. Okay, some redness. Is it more like a rash? Okay. Okay. And do you have some of this now? Like, do you have a rash or some skin irritation that you could potentially show me? Okay, behind your bangs. Okay. Let me take a look. Okay, yeah. Okay, let me take a closer look here. I want to make sure that we are not sort of doing this all willy-nilly, right? So let's just put this, your bangs are a little bit in the way, so I'm just going to, okay. And then over here, just a bit, and, okay, good. Okay, so let me just look here. Okay. Yes, I see it is a bit red, sort of redder than your sort of natural flush, right? And then is it itchy? Okay, it's a bit itchy. Yeah, there's a bit of flakiness. Yeah, it is, it's exhibiting symptoms of a rash, but I wonder, have you been in the woods any time recently? Camping or something like that? No, okay. That's fine. That's good, okay. Okay, well, you can go ahead and relax. Okay, so with that, I can confidently say that it is some sort of allergy. Now, what allergy it is really depends. Now, as an allergy doctor, I will recommend that you do the allergy test. You can, of course, say no, and it is a long-ish process that will span a bit of time. What I mean is, if at any point you're uncomfortable or you don't want to do it anymore, that's totally fine, but you will have to follow up with another doctor. If at any point you're uncomfortable or you want to, stop, that's totally fine. You need to take care of your own health. What I will say is that because we are dealing with sort of allergens, I cannot just let you go without having some form of other appointment, either with me or with someone else. So if you don't want to see me, you don't want to, come back, say you don't want to continue this, that's totally fine. There is no hard feelings in any way, shape or form. But you do need to at least follow up with your primary care physician because they will be able to take care of you and at the very least inspect what may have been done, right? To ensure that you are not having some adverse reaction and that sort of thing. Now, with that said, are you driving? Did you drive here? Okay, good. Yes, we don't want you really to be driving that much. It's really not that big a deal, but if you do end up having some form of reaction, it's going to be a small reaction, so, it's not going to be very large, but sometimes some people, they end up having a bit of a problem, particularly because we do end up doing it on the forearm, right? So some people will, as they're driving, it might irritate them, and we really don't want that to be a problem when they're driving, okay? It's my policy, really. Okay, so with that, let's just go ahead and get started. Do you know how an allergy test tends to work? Oh, it's your first time. Okay, well, that's totally fine. What I'm going to do here is I'm going to put on some gloves, very standard gloves, and then I'm going to inspect the skin on your forearm first. You will have the choice, right or left arm, and from there, I am going to split with a marker. I'm going to draw quadrants into your forearm, and then I'm going to place in each quadrant a small amount of an irritant, right? Something that you might be allergic to. Now, of course, you might not be allergic to anything, in which case It should be totally fine. You should have no reactions. You will always have one that has no reaction. That will be our sort of typical. It should be no reaction, because that is how we know that the test was conducted successfully. If there is a reaction, then that just means that something went wrong and we'd have to redo it at some point in the future. Okay. So from here, let me go ahead and put on some gloves. Now, the irritation that you might feel, it might happen immediately, but it also might happen over time, right? Which is why I need you to come back either to me or to someone else, because you might have some irritation, you might have something, right? So you want to make sure that you have the proper inspection. Okay, so can I see your arm, please? Okay, yeah, let me see. Okay. Now, how does this feel when I press here? Good, okay. Yeah, I just want to make sure that there's nothing wrong here before we start this test. There's nothing strange or unusual. But really, it's a bloody fantastic forearm. Alright. Okay. Okay, very good. Okay, so from here, let's just go ahead and if you would please, okay, just splitting it here. Very good. Okay. Does it feel okay? Yes, it's not permanent, so you should be able to take it off very quickly. But we also don't want it to go away very quickly as well. It should, with a good washing, it should go away. But anyway, from here, we will go ahead and start. What we're going to do is I'm going to place with an eyedropper, not an eyedropper, but with a little liquid dropper, I'm going to place one of the irritants. Each one I will tell you about it. And then I will also place a bit of colour next to it. The reason why I do this is because sometimes, things get lost in the shuffle. Sometimes with our notes and everything, there is some, it's to prevent mishap, right? So say, for example, I say that this quadrant here, it's for moss. Are you allergic to moss? And I put the colour for moss. But if there is, say, a problem, right, and actually this the irritant that I put down is not for moss, but say it's for grass, very similar but slightly different, then it will react to the colour. If the irritant is the correct irritant, then it will not react to the colour. Okay? All right. So let's go ahead here and start. Getting our first one, and this of course will be moss. Just want to make sure get some of these typical. So give me your arm, please. Okay, very good. Place that to the side. Just make sure that it is getting nice and dry, and then what I'm going to do is grab a bit of the moss related colour and just tap. Okay, good. Alrighty. Well, that's moss done. So next we are going to do grass. So let's make sure that we get some grass here. Okay. Alright, we'll put that next to the moss. Okay. So let's do that. Yes, the moss colour is sort of a mossy green, but then grass is going to be orange. Isn't that interesting? Okay. Alright, so let's go ahead and good. Okay. All right. How are you feeling so far? Good? Good. Let's go ahead. Okay. So now this one is going to be sort of trees. More specifically, it's going to be sort of redwood trees in particular, because it's very popular here. Okay, so very good, very good. Just a little bit is all we need. Okay, and then all the redwood trees we're going to use. What is the colour? Yes, of course. So I know it's not very it's not a very colourful array, let's say. You know, it's a bit of a mishmash, but you know, that's science for you. Okay. Now, let us go ahead and go on to the next one. All right, let's go ahead and go on to the next one. So, yes, now this one is going to be mold. Yes, and depending on what you are, hold on. Okay. Yes, and depending on what you are allergic to, we'll be able to narrow down where precisely you are encountering these irritants, right? If it's mold per se, then it might be something to do with your house. You know, maybe, do you live in a house? Do you live in a flat? Okay, well, depending on where you live, you know, it could be mold within. You know, within the walls or something. If it's really old and, you know, it's sort of expected, but some molds are very, you know, very difficult to say. It's just something to keep in mind, right? So I've had patients before where they've realised that they've had mold in their homes, they've had to upend their entire lives, all because of this allergy that they've come to take this test on. It's bizarre. Okay, so just putting that mold colour. Okay. Very good, very good. Okay. Do you have a guess as to what's next? I like having my patients guess a little bit. It's really, it's not, it's something fancy. Okay. Yes. Yeah, no, this is just compost. Yes, I know, it's mainly because, you know, when you have a lot of greenery, compost is very common, particularly, you know, it's what they use. So we want to make sure that you are not allergic to that sort of thing, because it does get picked up by the air, by the wind. Okay. So. Okay. Very good. Okay. Now this one's not a very fun colour. It's brown. You know, the most apt, I suppose. Okay, very good. All right, only a couple more left. No need to worry. By a couple, I do mean a few, right? I don't really mean two. Okay. All right. Okay. So, are you starting to feel anything? Okay. Yes, it's totally normal. It is an irritant, so it will, you know, it will feel a bit strange, but if you feel itchy or tingly, then that could mean something. Okay? Okay, so give me your arm. Yes, this one's going to be for nickel. Okay. Okay. Very good, very good. Okay. So nickel, we're going to go with a nice grey. I know sometimes it works out. Okay. Okay. Very good. Okay. And then what we're going to do is the control. Okay. Give me your arm. Okay. This is in the quadrant where there is no irritant, but if it does get irritated, it means we've done it wrong. Okay? Okay. Very good. Very good indeed. Okay. So with that, the control will need a colour. This one's pretty simple, to be honest. Okay. Very good. Very good. Okay. Now that we've done that, how does it feel? Does it feel okay? Okay, very good. Try to keep it in sort of bare air. We don't want it to be sort of covered by anything. Now, you might be confused, right? Because why would you have it in the air or just like sort of plain in the air, right? Because something might come along and sort of affect the results, but it really shouldn't actually do anything that major. It is a small irritant, and although it's small, it's pretty potent, so it should be totally fine, okay? All right, so with that, what we're going to do next is we're going to have to really push some of the product into the skin. Because what that means is some of the irritants, because they're pretty potent, when they're staying on the skin, it might not cause an irritation, but we want to just try and get a more general view, okay? A more general feel as to what each, how it's reacting to your skin, right? So we need to just gently rub it in so that it's getting its full effect. And that way, based on the level of irritation that you have, we'll be able to actually determine what might be the cause of your natural irritation that's been happening. Okay, so with this, actually it doesn't need to be that long. Okay, so stay still for me and just give me your forearm and I shall... Okay. Okay. Very good. Yes, it's just trying to massage the skin. You might be thinking, aren't I just mixing it all around? But no, this is a special kind of massager here. It does not abide by that type of logic. So, no need to worry. Okay, very good. Very good indeed. Okay. So, how are you feeling? Good? Good. Okay, well, let's take these off, actually. Let me take these off. And let us remove your bangs. You know, I don't want you to sort of leave with sort of the irritation on view of everybody. I assume you don't want that. So let's go ahead. Okay. Well, if you need anything from me, my secretary, of course, is in contact, or you can sort of talk to any of the nurses. They should help you as well. But it should be all good. We will have you set up for a return appointment. Yes, the irritation should take at least 24 hours before it fully sets, in which case we will then need to check it. So, are you free tomorrow at any time? Okay. If you need me to write a note of any kind, that's totally fine. I'm happy to do that, okay? Okay. Okay. Very good. Well, if that's the case, then we'll just go ahead and get you set up for that. Hopefully, this was a fairly painless procedure for you. And with this information, hopefully we'll be able to determine, or at least pinpoint more precisely what is happening, okay? Okay. Well, I will see you tomorrow then, okay? All right then.